Assalamu alaikum. My name is Sarah Zaman. The drug I'm presenting today is Grisofulvin. First, some brief information about Grisofulvin. Grisofulvin is a systemic medication. It's an antifungal agent. Now, its indication or what it is used in. It's used in the fungal infections of skin, hair, nails, and scalp. It treats the dermatophyte infections, which is caused by trichophytans, microsporums, and epidermatophytans. The rationale of the drug is that it should be used with fatty meals, either in one dose or in divided doses. The dose of grisofulvin usually ranges from 375 mg per day up to 1 gram per day in a usual adult dose. Irrational of the drug is it cannot be used in certain infections like candidiasis, mycosis, bacterial infection, deep fungal infection, and nocardiosis. This drug is not effective against these. Availability of this drug is in oral tablet form, which is most common. It has two sizes, 250 mg ultra micro size and 500 micro size. It's also available in liquid suspension. The duration of its use is 4 to 8 weeks for skin, foot, and scalp infections, and for much longer for finger and toenail infection. That is, it's used for 6 months in finger and toenail infections. The dose of it is 10 to 20 mg per kg per day. As for the side effects of grisofulvin, it's actually quite safe drug as compared to the rest of the antifungal medicine. The only inconvenience is that it's a long duration of use. So coming back to the side effects, most common side effects are headache, upset stomach, vomiting, diarrhea, fatigue. The more severe ones include hepatotoxicity, skin allergies, face and tongue swelling, yeast infections of mouth, and other allergic symptoms. Now, the mechanism of action by which it produces its effect. Basically, the actual entire mechanism of action of grisofulvin is still very unclear, yet there are some features that tells us how it works. So grisofulvin is a fungistatic. It's not fungicidal. Means that it stops the growth of the fungi. The drug darasal binds to keratin. It also binds with alpha and beta tubulin and interferes with the function of spindle and microtubules, therefore inhibiting the process of fungal cell mitosis. Grisofulvin protects the skin by inhibiting nucleic acid synthesis and fungal cell mitosis. This restricts their multiplication. This way, they prevent the spreading of the disease to the newer cells. For the drug interactions of grisofulvin that occur most frequently are with warfarin, oral contraceptive pills, barbiturates, alcohol, cyclosporins, and salicylates. Contraindications. Now, some contraindications that we should be cautious of while using the drug. The drug grisofulvin is contraindicated in people which have hepatic impairment, lupus, porphyria, and it's also contraindicated in pregnant women, breastfeeding women, and people who have hypersensitivity towards grisofulvin. Further studies have now the alternate choices with reasons. Further studies have proved that the different alternatives of grisofulvin are more effective, safe, with higher cure rate, and less chances of relapses also. For example, terbinafine, it's a fungicidal. It interferes with the ergosterol biosynthesis and it is effective against trichophytans. The next is azoles. It includes fluconazole, itraconazole, and ketoconazole. They deplete, the mechanism is that they deplete the ergosterols, which damages the fungal cell membrane. Fluconazole is mostly given to patients who suffer the intolerance of grisofulvin at very high doses. Among them, itraconazole is the most common to prescribe in fungal infections. Alternative brands. So here are the 3 alternative brands that are available in Pakistan with respect to their prices from low to high. First is Gryphon, produced by the company FYNK Pharmaceuticals. The next is Grisofulvin V, produced by Karachi Pharmaceutical Laboratory. And the next is Fungivin, produced by Ethical Laboratories. For the choices of the drug, now Grisofulvin. Grisofulvin is available in tablets, suspension, and sprays. Sprays are mostly just for athletes' food. But Grisofulvin is more effective as an oral systemic medication rather than the topical one because its topical absorption is very poor. So oral Grisofulvin is always preferred as it is absorbed more rapidly to the affected site. Now sharing a case study with you. We have an infant who is 12-month-old. He is an Italian Caucasian, presents his history with erythematous scalp lesion, annular patches with loss of hair. Otherwise is in a good health, showing no fever or other symptoms. Family has no pet and no contacts with animals. Member of the family are asymptomatic. He is suspected for dermatophytosis. Wood lights exams show bright green fluorescence on the lesions. The clinical culture and microscopic examinations were done. The result is positive for tinea capitis by Microsporum canis species. Subject. The chief complaint is of erythematous scalp lesion, annular patches with hair loss. For the object is a 12-month-old infant. He's a male, Caucasian, Italian, and the labs and the cultures have shown a dermatophyte infection caused by Microsporum species. It's a tinea capitis infection. Assessment. So tinea capitis is also known as keroin or a ringworm of scalp. Tinea capitis is a fungal infection of scalp. It results in red lesions, circular patches, and hair loss. Lesions are circular or ovule with clear center and erythematous periphery. As you can see in the picture, the center is quite clear and the corners have a red periphery. Microsporum canis is a dermatophyte which infects both animals and humans, so it can be passed from animals to humans also. Microsporum canis is most common in Europe and Mediterranean basins. For tinea capitis, as the child is from Italy, he might have gotten from there. And Microsporum canis is a very common species there, so it affiliates with the child condition. Tinea capitis is very rare in infants and it occurs mostly in the children who are aged between 3 to 7. Now coming to the plan, the therapy is a combined therapy. That is, we are using both oral agents as well as topical agents. The plan is that we are giving oral Grisofulvin 20 mg per kg per day, first choice in children because it's more safe, well tolerated in children, and has the least side effects. It can be given in either single dose or in divided doses. The topical treatment is a topical cream of itaconazole, can be applied 2 times a day. And to clean, we are using iodized alcohol to clean the lesions. These medications should be taken regularly to prevent any relapses of the infection. You should not share any combs with infected individuals. Keep the scalp clean and dry and never wet. The therapy should last till the lab cultures are all negative and the scalp lesions are healed completely. For the follow-up, the child has to come for physical exams of his scalp and hair. We should also perform culture test every 15 days to check if it's negative or not. The references, thank you.